We are here at the BW's HealthTech Festival, and we have with us Mr. Sunil Khurana. Thank you for joining us, Mr. Khurana. Uh, what I want to ask you is we are seeing that medical devices industry is growing in India at this point in time, but at the same time there are challenges in terms of regulation, and there are other challenges when it comes to starting a medical devices company and what kind of investment it requires. So as per you, what are the major large challenges that you see, and which can come as a hurdle to this growth that we are all waiting for?
Thank you. Thank you so much. See, medical device is a very vast area, as I told in the beginning also. There are many challenges we face. The biggest challenge which we face is that there is no ready-made R&D people available. So you have to recruit the freshers from the institute, build them, and then over a period of time they start delivering it. So this is a one definite challenge. Because if you want to build a product very quickly, it is not that you can just go to the industry which is matured and pick people and use them to build your product which can be taken and localized and taken from the manufacturing. This is one challenge. Second challenge which I see is that making products in India is quite expensive because your scale is still not very high. If scale is not very high, at the level you buy a component and other things and finally make a product, that cost of machine will be slightly higher or quite higher than the products which are coming from developing market like China. Now their cost is very low. And that low cost, when it also hits your border, which is your customs, custom is very low now. Custom is only some 5 to 10%. That is so low that they will never allow you to sell your products at a profitable level. And if that continues, many companies will come and vanish because it is not going to be successful. So government should look at it, that what kind of protective mechanism, and protective could be sometimes seen as a wrong word, but what kind of motivating mechanism we can take through, like maybe raising a custom duty itself. Because that's very fair. If you raise a custom duty, you're trying to protect your industry. So this is one. Similarly, government must ban all the medical equipments which are used coming from outside. Most of the countries have banned the second hand or used refurb machines to come in the country. We should also ban. Because suppose there's a product which is coming, which is generally sold as at a 3 crore rupees product, and second hand machine comes at a 2 crore. Some Indian company has made good attempt to make that product at 2.5 crore. People will tend to buy a used machine because it's a branded machine. So that will kill your industry. So, there are many areas which I see today as a hurdle. Third, which is most important for a manufacturers like us, is that CDSCO, which is a really very stretched organization. They are the regulators now. They give a regulation, for you to finally launch a manufacturing. They are taking a lot of time because of probably they are very short staffed. And there is a date which is 30th September coming just few days away from now. And, type 3 and type 4 products also deadline is that. Now, they are not able to give approvals because they give you many queries, we respond, then they can give a query, and the process time from one application to completion of the approval is a very long process. So that needs to be definitely shortened, and some relaxation should come there is what I feel.
A lot of people also talk about transparency in approval process, in drug approval process, in medical devices approval process. Do you see that as a challenge as well? Do you, as an industry person, look forward to more transparency?
So I would reword it transparency toward the probably lack of oral understanding, because most regulators have a better understanding about the drugs, and drug understanding and medical device understanding is two totally different space. So I don't think there is a transparency issue, but there probably lack of the same understanding what is required is a problem. I'll give an example. Today, in a global arena, or let's take a Europe, you want to make a medical product, nobody will stop you to make a medical product. You create a product, design it, do everything, and then go for a EMC, EMI testings. And after that, you go for a C certification. And once C is there, you can launch a product. Now, in our case, we are not even permitted to do that. We need to first get a test license, then step by step, you have to have a license, not required. So, you understood my point.
Yeah.
That one side there's a free flow and you create a product which is perfect. Why should I go for those steps which are not going to be any advantageous? Rather, it's a road blocker. So, we need to bring a little bit more practical approach. This is again not a transparency. It's a question how you write the script. That script has to be written better, and keeping in mind that regulators are not policing. Regulators are also overall trying to understand and help. That's the difference which I want to say.
Right, right. You also spoke about R&D and the role of academia, and you spoke that in your first comments as well, and how in the West it is a very normal thing that happens there, that the academia and even pharmaceutical companies, medical devices companies partner, and that the research is over there. Why is it not happening in India?
Uh, no, my question generally to a large group is that how many of us are keen that our kids become scientists? The R&D culture in India never existed much, right? It is now catching up. You can see a lot of startup, people want to do their own thing. So this is happening now. So DNA wise, if you see, our DNA has been more that let's make them a doctor, engineer, lawyer, and this and that. But nobody thought that we'll make our kids into a scientist. So we lag there. Why? Reason is that we still invest as a country less than 1%, more like a 0.8, 0.85% of the GDP size toward the R&D. So our R&D investment is too small. Now look at China. China is a simple example. They invest about 3% of the GDP. Now it is not 0.75% to 3%, which becomes 4 times. That's not only 4 times. You should see that we are a 3 trillion economy. They are 15 trillion economy. They are 5 times bigger. That means it becomes 4 into 5, 20 times more R&D investment is happening there. So unless you start putting more investment in R&D, bring that as a culture, it, it has a challenge. Because so far we were trying to copy and build things. If we have to go for a DNA of this, it will take time. Any DNA building takes time. I think the way government of India is now trying, I mean, recently they've launched a PRIP, that is to promote R&D, there's some subsidies coming from the government of India, because which is very important. You create a subsidy, give a subsidy, create a product, and then launch to the medical devices to the manufacturing side. Now, this is going to help big time, and this was a demand from industry. I feel the way government is going, it's very bright. It looks extremely good. As time flies, we will do a lot of research. We will make a lot of innovative products from India, which will go to outside market.
Right. Thank you so much, Dr. Khurana, Mr. Khurana, for joining us here. Thank you.